Find a comfortable and well-lit space. The individual will need space to move their upper body to turn the jar lid. If there are cupboards, etc. over the individual, ensure that they are closed, and the individual has enough space to move their head and neck. It is recommended that the task is completed with the jar at waist height, with the individual sitting down at a table or counter. Make sure you are sitting at a table at an appropriate height. Have your feet on the floor and keep your back straight. Make sure you have your area and equipment prepared and laid out. Gather the equipment needed. You will need a jar, a table, and adaptive equipment if required. Make sure that the jar is dry and clean to ensure the best grip. Place the jar on a steady, non-slip surface at waist level. Establish the direction for turning. Righty-tighty or clockwise, lefty-loosey, anti-clockwise. Using the non-dominant hand, grip the jar on its side to stabilise the jar's body. Hold the jar as close to the body as possible. Place the dominant hand on top of the jar with all 5 fingers spread around the lid. Twist the lid in a clockwise or right direction. Place the lid down onto the surface. If this does not work, we have some other options that might help. To adapt this task, assistive or adaptive equipment can be used. You can use a jar holder. Place the jar holder onto a stable surface. Place the jar into the jar holder. Using your non-dominant hand, hold the body of the jar. Using your dominant hand, place the jar into the jar holder and twist the lid of the jar counterclockwise. You can use a non-slip mat. Again, place your jar on a stable, non-slip surface. Using your non-dominant hand, hold the body of the jar. Using your dominant hand, place the mat on top of the jar and twist the lid of the jar counterclockwise. You can also use a jar opener. Using your non-dominant hand, hold the body of the jar. Then using your dominant hand, place the jar opener on top of the jar and twist the lid of the jar counterclockwise. Some practical tips. Initial steps may include establishing hand dominance, so left or right-handed. Establishing directions to turn the lid, so righty-tighty or clockwise, lefty-loosey, anti-clockwise. When beginning to practice, it may be beneficial to begin with unsealed jars and focus on technique. Once mastered, you can work towards sealed jars. Place lid on and off the jar for practice. Some tips for teaching. The 3 C's of communication: clarity, conciseness, and consistency. Provide the same clear, short instructions each time to avoid any confusion and to create a structured, stepwise approach in your child's head. Little and often. Remember, your child may not learn all the steps in one go. Encouraging short, regular practice and teaching sessions over a longer time frame may be beneficial. Affirm success and encourage effortful attempts. Celebrate each step completed as a success and provide praise for effort and not just end result. Be patient. Give your child enough time to process, attempt, succeed, and fail, potentially giving several sessions before completing all steps. Grading. As your child masters the skill over time, think about carrying out the task in more difficult scenarios, such as in a busier environment.